Welcome to the Motivational Interviewing for Home Health Part 2 conference call. My name is John and I'll be your operator for today's call. At this time, all participants are in listen-only mode. Later, we will conduct a question-and-answer session. During the question-and-answer session, if you do have a question, press star then 1 on your touch-tone phone. Now I'll turn the call over to Ashley Green.
Thanks so much, John. Good afternoon, everybody, and welcome to the second webinar in our two-part series on motivational interviewing for home health professionals. Thank you all for joining us today. Just a couple of quick plugs and announcements before I turn it over to Mia. I just wanted to remind everyone that we have developed for cardiac health purposes a toolkit that some of you may be interested in, and you can locate that pretty easily if you go to the Lake Superior QIN website. There's a section for the Cardiac Health Initiative, and if you navigate to that page, you'll find a series of resources off to the right, and our toolkit is listed there. I also wanted to put sort of a general request out to all of you, because you are attending this event, to let you know that, as I mentioned last time, Mia has recently joined Metastar, and we're still developing some curriculum for motivational interviewing for our region, and we're eager to get some feedback and kind of hear from you about needs that you and your colleagues might have around this. So please don't hesitate to reach out to Mia if you have questions regarding future offerings or things that you might think would be useful for you and the rest of your team, because we want to make these resources as valuable as we can for everyone. As you know, there were a couple of activities hopefully you got to, and so we're hoping this will be an interactive session, and as always, our operator John will tell you how to call in with your questions or responses you want to share, but if you feel uncomfortable with that, certainly you can use chat as well, and we look forward to engaging with you today. And with that, I'll turn you all over to our favorite MI Cruise Director, Mia Croyle.
Thanks, Ashley. I wish we were on a cruise. I remember when we did this call, when we did part 1, I was thinking, oh, the second one's in August. That's so far away. I can't believe August is here upon us now. So thank you all for taking a little bit of your busy time to continue talking together with me about motivational interviewing and how it might impact your work. So just as a brief reminder, after attending the final session, which is today, of this webinar series, we hope that we'll have better prepared you to identify the spirit of MI and think about how it's the same or different from other approaches, and then start to be able to integrate one of the core MI skills, and we'll cover this on our call today, of reflective listening. How do we integrate that into your practice? And hopefully you'll feel prepared to use at least one MI strategy as well in your practice if there are times that you feel like that would be a good fit. And we're also going to spend a little time on our call today thinking about a plan for next steps if you want to continue to grow in your motivational interviewing skillfulness. So, as I said on this call, we're going to start with kind of reviewing some of the activities that I shared with you for completing between our two calls. So that introspective worksheet and the agenda setting activity. I'm eager to hear from you what you found, what your experiences were and how that went, or what your thoughts were as you went through those. We're going to cover reflective listening, which is one of our key skills in motivational interviewing. We're going to go over a strategy in motivational interviewing for sharing information, because that is a key part of a lot of your roles is, education, informing the patients, sharing information. And so there's for ways to do that really keeps the other person actively engaged and empowered throughout that process. And then we're going to look at some resources for continued learning. If there are other things that you would like for me to address on this call, please feel free to enter them in the chat box. We'll have time for questions at the end as well, but feel free to put your questions in that chat box as we go along, and that way I can either hang on to them and make sure we address them at the end and you don't have to worry about remembering them, or if it's more pertinent to just address them in the moment, I can certainly do that as well. So I asked you or shared with you an exercise, the introspective exercise for you to think about completing, and that one was just a worksheet for you to kind of work through individually. And so now I'm going to ask John, our operator, to share with you how you could verbally participate, or, as Ashley said, feel free to put your responses in the chat box. But I'm interested in hearing from you. As you worked your way through that activity of the introspective exercise, what did you find? What did you notice? What things stood out for you?
And once again, if you do have a question, it's star then 1 on your touch-tone phone. And I have no questions at this time.
And I'm just checking the chat box here. Anybody want to have anything to share there? All right. So it seems like either maybe you didn't have access to it or didn't have a chance to do that introspective exercise. So I am going to read through it now, just briefly, for folks to think their way through it. And you can feel free to either share some of your responses or do this individually and just kind of take note of what your experiences are as you think your way through this. So part 1 asks you to sort of close your eyes and picture the thing that you're most embarrassed about, something you would be very uncomfortable if strangers knew. Now, disclaimer, I'm not going to ask you to share what that thing is on the call, but I'm just asking you to kind of sit with that thing for a moment and really think about what is that thing that you're most embarrassed about, or you really just wouldn't want other people to know about you. And now imagine that you're in a situation where you have to tell someone else about that. What would that situation be like for you? What thoughts might you have? What might you feel? How would you respond to a situation where you had to share with other people something that you really would prefer, that you didn't have to share? And then I'm also going to ask you to just think about what would be the worst response that you could imagine from the person you had to share that with. How could they respond that might make you feel even worse? What would that kind of response look like? Any thoughts about that? Please type them in the chat box. What would be an unhelpful response? All right. Oh, I see. Doing my best to navigate this chat box, but it's kind of small on my screen. So I'm seeing that I do have a few comments. It was good to gain the perspective of the client. Folks sharing that they would be hesitant to share it, and I think an unhealthy response would be judgmental, feeling judged. Something unhelpful would be if they responded with shock and judgment. Absolutely. So, one of the things that we know, I hear this theme of judgment being pretty common. And one of the things that we know is that beings, when we get the impression that someone is judging us, our bodies respond as if that's a threat. So we know what our bodies do with a threat response. They sort of go into that fight, flight, or freeze response. That, oh my gosh, there's a tiger across the prairie about to come and attack me. Our bodies know how to respond to that. Now, for most people, it's not quite that extreme of a response, but the same types of systematic response in our bodies starts to happen when we perceive judgment from another person. So I think our intuitive knowing that a judgmental response is not a good thing maps on exactly well with what we know from brain science and the science of our bodies, is that, yeah, that response is going to put us in a space where we're least able to, be thoughtful and planful and responding well. The next question on that introspective exercise just asked you to think about a few words about how you hope the other person might respond. So what would be a helpful response? What might help you better navigate that difficult situation? Thank you for sharing that with me. Yeah, just expressing the other person's gratitude for you going through the difficult thing and opening up and sharing that information with the other person. Let's see, asking how can I best support you? How can I help? I appreciate the trust you've placed in me. You guys know some great ways to support people when they make difficult disclosures. Absolutely. Give a minute for anyone else. All right. And then the second part of that introspective exercise asked you to think about a change in your own life, right? So something you've done at some point in time, even though you knew it wasn't especially good for you or healthy. It could be something in the past or something still going on for you. And it just asked you to think through, what were your reasons? Why did you do this? What was your rationale? What were your reasons for this unhealthy thing? For me, it's like my candy bowl here on my desk is sometimes my breakfast bowl, and I know that's not a healthy choice. But what are my reasons? Well, I have busy mornings, and I like sugar, and I get hungry if I don't eat breakfast at home, but sometimes it's hard to get breakfast before I get out the door. So those are kind of my reasons for eating a breakfast of Starburst, which is, true disclosure, what I had today. And then how much time passed between when I started doing this and the first time I was aware that there was a potential problem. You know what? I knew right away. I know the minute I'm putting that Starburst in my mouth, the minute I'm reaching for that Starburst for breakfast, I know that's not a healthy choice. So, thinking about what that might be for you and your behavior. And then thinking about how much time passed between my first awareness of potential problem and the first time I made an earnest attempt to change. Well, I've made many earnest attempts to change this, and I seem to just continue falling back into this pattern, but how much time passed between the first time I was aware of it, so then the next day I'm maybe a little more aware and I try to grab a breakfast on my way out the door. Did you ever experience success in making a change in this behavior? I have. I've gone through times where I have fruit and other healthy things in my candy bowl instead of candy, and I'm really dedicated to that. And then the next question, did you ever go back to this behavior after some successful change? Yes, I have. I'm right back where I started, mainlining sugar because it's, my habit. And then what were your reasons for going back? Well, I just said it's my habit. I think that's the main thing. It's my habit and it's what I go back to in times of stress. So what conclusions might you draw from your own experiences with making changes? I could draw a lot of conclusions about mine, but I guess I would be asking you guys what, as you thought through your own change experience, what conclusions can you draw about the change process just from thinking about changes that that were true in your life, or behaviors that were true in your life? Okay, change is a process. One success does not mean that the habit is forever kicked. That's absolutely been true in my case. It's hard to change behavior when other people in the house have the same bad habits. That's certainly true. We are definitely influenced by the people around us. It takes work. You shouldn't ever stop trying, or maybe that's just encouragement to me to not ever stop trying. I'm not sure. Set yourself up for success. Yeah, so when I do things and have structures in place, I'm much more successful than when I have the candy jar sitting on my desk with easy access to failure. What else? Don't let the failure to succeed get you down, right? If I just gave up and said, oh, well, I had Starburst for breakfast this morning, I guess that's what I'm eating for breakfast every day now, that would lead to a much bigger problem than just, sort of regrouping and figuring out what can I do differently tomorrow. Yes, the person needs to see the value in the change and not just be told to change. That's absolutely right. When I experience and approach change from my own reasoning and my own values and the things that are important to me, I'm much more committed to it versus, somebody said I should eat less candy. It's much harder to get at. All right. Well, thank you all for thinking through that, and I think it just helps to get a little bit grounded in this idea of change and the idea of, change is a process and it's a behavior and it is hard work. Because we spend a lot of our time working with people who are really struggling with change. And so, getting into a place where we're having some empathy for how hard that really is a helpful thing. So then I also wanted to check in with folks. We talked last time about the agenda setting worksheet, and it suggested to you that you partner up with someone and at least talk through this agenda setting worksheet and what it might look like for you if you were to use it with your patients and the people you work with on a regular basis. And then if you were feeling especially ambitious and or if you had the opportunity to go out and actually try and put it into practice with someone. So I would love to hear from folks how that went. Either the conversation, the chat, or maybe you sat by yourself and thought about how you might put this into place, put this into practice, or just, chatted it over with a colleague. Feel free to just any experiences, even if it was, I just didn't have time to get to this. That's valuable input too. So let me know how that went. Okay, we made huge progress with our member. No change has happened yet, but she really felt her concerns were heard by her care team. That's a huge change. And even though she hasn't actually, been actively working on the behavior changes yet, just that change in how empowered she feels and how well you're partnering with her is great. Tried it with a patient, was caught off guard that I was asking input into the education session. Yeah, our patients don't quite expect this, right? Because this isn't what we normally do. This isn't how people normally work with us. So it can be a little bit surprising for them the first time we might use something like this. And they might not have come prepared with things to contribute to the agenda. So I find that is definitely true. And if you use it repeatedly with patients over several visits, it starts to shape their preparation for the visit in a different way, so that, now if they're knowing that when you first start with them, you're going to whip this sheet out and, kind of the expectation is that they're going to have some agenda items. A lot of times they will have some agenda items prepared in their mind then, and ready to go. So it's a way to sort of extend the active time of the visit a little bit before your visit. They're doing some of that mental prep work. But absolutely, it can definitely catch them off guard the first time they see it. Someone said, I did share this tool with a colleague who thought it would be a great way to engage the learner by ensuring that their concerns and worries were addressed and added to the agenda. Yep, that's exactly it. The customer that I tried it with appreciated, quote, being part of the process, end quote, versus just being told what we were going to do together. She felt heard. That's excellent. That's exactly what we want. So that's one of the things that I really love about this tool is it just kind of is a way to make tangible our efforts to be really more patient or person-centered, right? So we say that and we're acting that way in a lot of sort of general ways, but this is a way that really puts it into something visible and concrete for us and for the other person. So excellent. I'm glad that was useful for those of you that tried it out or shared it. It seemed promising. Feel free to continue using it and ask me any questions that you may have as you roll it out to more patients. If you encounter some barriers or questions, feel free. So we want to talk a little bit about some of the core skills in motivational interviewing. It's hard to teach skills over a webinar, and this is really primarily what a lot of workshops focused on motivational interviewing will spend a lot of the time on the developing the skills. But the main skills in motivational interviewing we use the acronym OARS, which is open questions, affirmations, reflections, and summaries. And we are going to focus a little bit today on the open questions and the reflections, just because we just don't have time to get to everything in a brief little bit of time, but know that there's more out there than what we're covering on this call. So looking first at questions. So open questions are it's a pretty basic concept. Open questions, an open question is a question that asks for more than just a yes or a no. And in motivational interviewing, we encourage people to try to use more open questions to, get the other person talking more. It's one of the ways that we really try to evoke more content from them so they can do more of the talking. And we also want to focus on not just is the question open or closed, but how useful is that question. So useful questions are ones that support us having a better understanding of the situation, both us understanding the other person better and them understanding themselves better. Allowing people to talk and tell their stories helps them better make sense of what's going on in their life. They also help us maintain that connection or engagement. And we can use some questions to really directly ask for that change talk. And remember from last time we talked about how change talk is anything that the other person might say that could be considered an argument for making the change. So we want to allow them lots and lots of opportunities to give voice to that change talk. We want to encourage as much of that as possible because that really does lead to increased changes. It's been linked in the research, the more change talk we have, the better outcomes people have. So we want to create opportunities for that change talk to show up in our conversations with the other person, and directly asking for it is one great way to do it. And if the person seems like they're more hesitant and maybe not quite ready really to give you a whole lot of change talk or to talk about things that are more change-focused, we could ask in hypotheticals as well. I'll give you an example. Here's a few examples, right? So what would be the best thing, and then I have here about improved health. So you wouldn't necessarily ask it that way. You would tailor it to what the person is dealing with. You know, what would be the best thing about your blood sugars being better in control, right? And then letting them tell you from their point of view, what would that best thing be? Or how would doing X improve your health? So how will quitting smoking improve your health, right? And we're so well equipped in healthcare to tell the other person, you know, if you quit smoking, your health would improve in X, Y, and Z ways, right? Versus asking them first, because a lot of times they know some of the information that we want to be sharing. So asking them first, how would quitting smoking improve your health? Or we could, you know, and we can think about how do we make these questions a little more hypothetical, right? How will quitting smoking improve your health? If we want to be a little less direct, we could say things like, how might quitting smoking improve your health? How would, if you did decide to quit smoking, how might your health improve, right? So we can make those questions a little less direct toward the change, or a little more, depending on the person in front of us, right? So we can tailor those questions a little bit. And then if we were able, like when the person is really focused on a certain barrier, one way to sort of move the energy off of that is, you know, if we were to figure out a solution to your transportation issues, how would things be better for you in terms of your health care, right? And then they could tell you. And in that way, it's like we're getting them some, we're helping them make the argument for why it's worth it to expend the effort to solve the barrier, right? So rather than just solving the barrier first, we ought to kind of get them engaged and ready to go, because overcoming some of those barriers is really quite a bit of work. So those are a few open questions. That's a very brief little bit about open questions, but those are a few open questions that you might want to try that or some version of those with some of the people you work with and just see what results you get. Now we're going to talk about reflections. That's our R in the ORs, which are the skills of motivational interviewing. And reflections are really a statement. Sometimes they're also referred to as reflective listening or also active listening, sometimes they're called. And they're a little bit different than in motivational interviewing than we might see them in some other disciplines. But, you know, reflections are a statement, so we got to end our sentence with a period and not a question mark. And they offer a hypothesis about the meaning, as opposed to oftentimes we make guesses about what a person meant, and we just make those assumptions and move forward without checking them out. So really our reflections are a way to check those assumptions out with the other person, make sure we're accurately understanding them. They are generally perceived as non-threatening, and they show a lot of empathy. They show our effort to understand the other person. They help us maintain a focus on the other person's content versus shifting into more of, you know, our agenda or our educational content or something else that our recommendations. Our reflections help us focus on the other person. And they often help people better understand themselves just hearing what they said back out of someone else's voice. And what you choose to reflect can also shape the direction of the conversation. So it's a way we can more subtly give some direction to the conversation. When we offer a reflection back to a patient, it offers them another opportunity to basically say more about what they just said. So they might go on and expand upon what they said. They might further refine it and give you more detail. We may have made a sort of incorrect assumption, and then they'll just correct us. People are often very worried with their reflections about getting it right. And what I like to tell people is oftentimes those guesses where we miss are just as informative. They can help us, you know, the other person might verify, yeah, you've got that exactly right. Right? So it gives them a chance to just say some more about it. And there are two types of reflections. There's simple reflections and complex. Simple are I think the ones that pop most into people's heads when they think about reflections, when they hear reflections. And these are just a very simple repeating or brief rephrasing of what the other person said. So we offer these because they help just sort of hold a safe space, they show our empathy and our understanding, and they encourage the person to keep talking. They don't do a whole lot in terms of shaping the direction or getting us a lot of movement, and we'll look at that a little more with complex reflections. But our simple reflections really are simple, and so we'll look at one. So this is an example of a patient statement. I don't know what I'm going to do. Drinking has been a hassle lately, but I just really like beer. So if we were to offer a simple reflection in response to that patient statement, it would sound something like, you might say, you don't know what you're going to do. You could also say, drinking has been a hassle lately for you. You could also say, you really like beer. Right? Thinking strategically about we're wanting to encourage the person to give us more change talk, it would not necessarily be the best choice to reflect back, you really like beer. Because then they're going to tell us more about what they like about beer. That's kind of how those reflections work. But if I said, drinking's really been a hassle for you lately, I'm going to hear more detail about what that hassle was. And that's kind of what I'm curious about. And I suspect that that's where some of the change talk is. Or if I really just want to show my empathy for the person's experience, I could reflect back, you don't know what you're going to do, right? It just shows some empathy for, the person is really feeling kind of stuck and lost. So simple reflections really are just that. They're simple. We just take part of what they said and repeat it back to them, turn it around like a you, and then what they said, and make sure it ends in a period and not a question mark. Because if I said, you don't know what you're going to do, that's a very different tone to you don't know what you're going to do. Right? So we have to be careful with our inflection, with both the simple and complex reflections. But our complex reflections are really where we get to do a little more work, because we're trying not just to capture what the person said, but to really get at what did they mean when they offered this, when they said whatever they said. Really, what did they mean? And so we might be reflecting on unspoken emotions. We might be getting more at their meaning, the values, and the intention that's underneath what they said. We might be offering a metaphor. Or we might be thinking about, if the person hadn't stopped talking, what might they have said next? So we'll look at the same patient statement here, and I'll give you some examples of complex reflections. So if we really wanted to offer a complex reflection about their emotion and some of the unspoken emotion, you're really feeling stuck, and you're kind of feeling lost about what you might do next, right? So I'm not just going on what the words that they said. I'm using a little more creativity, but I'm making a very reasonable guess based on what they told me. Some of this also we have to remember when we're looking at these reflections is we have the whole context of a conversation and a live person in front of us in real life. So it's a little bit easier than just taking some words on a page. If I wanted to reflect maybe a metaphor, I might say something like, you're really feeling like you're stuck between a rock and a hard place here. If I wanted to think about reflecting, what else? If I wanted to think about reflecting, what they might have said if they hadn't stopped, I might say, and you're really hoping that together we can find some solutions, right? They could have maybe meant that. I might reflect back some of their intention or meaning underneath this, which might be, you're really trying to find a way to meet all of your needs, get rid of the hassle and keep the thing you like. So So those are some examples of some ways that you could offer a complex reflection or a simple reflection for that statement. And now we're going to do a little you try it. We're going to try a little practice on a webinar format, which is a little unusual, I know, but I'm asking you to actually try some of this out. So here's another patient statement. I'm going to ask folks to try and come up with a reflection, either a simple or a more complex one. And you can either, I think you guys have shown me that you kind of like type it in the chat box, so you can type it in the chat box, and we'll go from there. So the patient statement would be, this is around medication adherence, right? So, oh sure, I can take these pills fine on most days, but on days when I do my shopping, I can't trust that I'll be able to find a bathroom in time. So I just don't take them on those days. So this is probably about a diuretic. And so just think about what might you reflect in there. And just type it in the good old chat box. What I hear you saying is you take the pills most days, but days that you're out and about, you can't because you can't trust them. So you're not taking your pills on some days. There are some days when you don't take your medications. So you try not to take your medications when you're shopping. Sounds like you're worried about having an accident if you take your medication. Sounds like most days you are able to take your meds. That's awesome. Okay? So really focusing on the strengths, right? Just give it a minute in case there's any others coming in. If you're not typing it in the chat, I hope you're at least trying to formulate a reflection in your own mind or jotting one down for yourself. So absolutely, all the ones that you shared are great reflections. Some were a little more simple, some were more complex. Some of them focused on the barriers, right? So in this statement from the patient, we hear both some success, right, and some areas where she's, having some success. She takes the pills fine on most days. And then we hear some of her barriers, but on days when I do the shopping, I can't trust, so I don't take them on those days. So, based on the trajectory of your conversation and your relationship with that person, you get to decide, are you going to reflect more on some of the barriers and the challenges that the person's having, or are you going to reflect more on some of the success that they're experiencing and do a little, strength-based work on there? And there's no one right or wrong answer because it really is going to depend a little bit more on, who the exact situation for that person. And yeah, you can just think about where do you want to go next, right? So I often think about it like a little bit of a choose your own adventure, right? What I reflect is what I'm going to hear more about. So if you say, sounds like you're worried about having an accident to take your medication, I'm going to hear more about their concerns and their challenges with continence and the diuretic and how those mix or don't mix and what she's tried or what she hasn't tried or what he's tried or what he hasn't tried, right? If I reflect on, sounds like most days you are able to take your meds, that's awesome. I'm going to hear about, maybe how they're able to do that, what their system is, the pill box that they use or whatever they're doing to make that possible. So you get to decide where you want to go next and what you want to hear from them about next. And that would be what I would suggest you reflect. So let's try one more. And this is still the same, so it could be Could be the same. It's also on medication adherence. So you could imagine this is the same patient or a different patient. It's kind of the same type of conversation, right? So they're talking about taking their meds. The morning pills aren't a problem. The ones at lunch aren't a problem either if I'm at home. But when I go out for lunch, I don't always remember them. And then by the time I get home, it's too late. The bedtime ones are fine, unless I fall asleep out in my chair watching TV. Those nights, I guess I miss a dose too. So what might you want to reflect in there? What are you hearing the person saying? Sounds like you're taking your medications only sometimes. How often do you forget to take them? So that's technically a question, but I would think you could absolutely pair a reflection with that question because we do want to start, getting some more specific information. Another reflection offered is it's easier to manage your medications when you're at home. It sounds like you struggle most with the pills before lunch in bed. You take your morning and lunch pills regularly. It's difficult to take medications multiple times a day for you. Nice. So yeah, lots of good, really what we're trying to do when we're doing our reflective listening is it feels like a little bit of a difference in the way I listen, because when I'm listening with the intention to reflect, I'm really listening for those themes and main points as opposed to some of the details. And we do have to gather the details too, right? If I'm trying to get the exact specifics about how many days a week is this person actually taking their meds as prescribed, I'm going to have to at some point get to some specifics. But I also want to get to that experience for the patient and what is the experience like. So we've got a couple more came in. What I hear you saying is that sometimes taking medications can be a problem on some days. Most of the time you remember to take your medication unless you're busy or sleepy. I may have missed a few, sorry. The chat box sort of scrolls by me pretty quick. We're just trying to help this person feel heard, right? So to me, it's easier to read the situation and come up with a solution when you have time to think about it. How do you do that on the fly? That's a great question. I can tell you it gets a lot easier with practice. It also gets quite a bit easier when you have a live person. When you have a live person in front of you, number one, that you don't have time. It's not written down and you can't look at it and think about it and revise it. But you also have the benefit of all of their nonverbal communication and the tone of their voice and everything else. And what I find is that a lot of times the easiest things to reflect are some of that unspoken emotion, right? So if I had a real life person in front of me, I might be able to even reflect something like, you're kind of worried about the times that you don't take your medication. It's hard work and you're not feeling great about the fact that you don't always get the meds in on time, right? And that's really more key to the person's experience of it, which is partly where we want to go. I can tell you when I first started using reflective listening about 10 years ago, it was pretty hard, and it took a lot of my brain space to do it. And all I could do was just try to get some reflections in each time I had a conversation, maybe just aiming for one reflection each time I spoke with someone. And then after some practice, it starts to get easier and you can start incorporating more and more into it. But it definitely is harder to do on the fly. Another tip that I've heard from lots of people I train is that they practice this with people who are not patients first. They practice this on their family and friends when they're in just normal, natural conversations and the pressure isn't quite so high. So that's another potential trick that may or may not work for you. So we're going to shift gears away from our reflective listening a little bit and look at one more strategy in motivational interviewing. We're nearing the end. We're going to look at strategies and we're going to talk about a couple of potential next steps. So as I mentioned, recognizing that in healthcare, most of our roles contain some bit of information sharing, whether it's a lot and the majority of what we do is educational sessions, or whether it's, just teaching somebody how to do something or informing them about something as part of lots of other things we do as our role. So in motivational interviewing, one of the ways we try to share information that still keep us in that spirit of partnering and engaging the other person actively and empowering them to really be the experts on their care is this process called explore, offer, explore. Now you may hear it in some folks call the same process a couple different things. So you may also see it referred to as elicit, provide, elicit, or ask, tell, ask, right? So those are, just to keep it complicated, we've named the same process several different things. But in here, so basically the first step is that you want to explore what the person already knows. You start with them. They're the expert. So what do they already know? What might they have interest in hearing more about? Or what are they willing to hear more about or learn more about? So this might sound something like, before we start talking about your medication, I wonder if you could tell me what is your understanding of what your pills do, what each of your pills do for you, like why you take each one of your pills. And then you could understand, you can hear what their current knowledge is. Then if there are big gaps, we might then want to offer some information. And to do that, we want to get their permission before we do that. So would it be okay if I shared a little more information with you about that? Assuming they say yes, I would share some small bits of information. Your medication, this pill is supposed to be doing this, and this pill really works by doing this, and we hope this pill is going to help you with this, right? If we're talking about coming up with an action plan, we maybe would offer a menu of options. So we share the information, and that's the part, that offer part is the part that I find people are most comfortable with and that they're already pretty well set up to do. And then the important step is that third, explore, right? What do you think of that? What reactions do you have to that information? How does that fit with your current understanding of things? What ideas might that generate for you? What do you think some next steps for you might be? And then we can also ask them, what questions do you have? But what I find is that when my providers provide me with some education, usually they don't do that first explore at all. They just start with the offer. And then after the offer, then they go to what questions do you have? Or do you have any questions? And often I'm not ready to have a question formulated yet because I'm still making sense of the information. I'm still reacting to it in some way. So this explore, offer, explore is a way that we can share the information just in a nice little sandwich of reminding the other person that they're in charge and they're the expert. So I wanted to share that process with you. It's pretty simple and straightforward, but it really can have a big impact when we're doing a lot of sharing information or educating or advising. So we're nearing the end of our time. We'll have a little bit of time for Q&A in a minute. But I just wanted to share with you some possible next steps, right? So what people have found is that, after webinars, even after workshops and motivational interviewing, there's no change in people's actual skillfulness unless they do something to try to have some committed effort toward really increasing their skillfulness in motivational interviewing. So some things you could do there's a lot of online blogs, there's even a podcast now, there's lots of free online videos available, there are online courses, free modules you can take. So all of those are available, at no charge, just on the wonderful internet. You can just experiment on your own. Like I said, just work to, try. Maybe you set a goal of, this conversation, I want to have one reflection, and then figure out how did that work, and pay attention to when that starts to get easy. Maybe move the target up a little bit to 2 reflections, something like that. There is a workbook, motivational interviewing workbook, that some people have found is really useful to work through some of the exercises and do. You could join a learning community of peers here at Lake Superior Quality Innovation Network. We have a LinkedIn group that is focused on motivational interviewing, and we're also thinking about what else might make sense, whether it's a group of folks that get on the phone on a regular basis or a listserv or something like that. So you could make that more localized and at your organization have a group of folks who just want to work together toward learning motivational interviewing. You could record yourself practicing with a patient or a friend or someone doing a role play and just listen back and look for areas where you might want to improve. Or you could look at attending a workshop, and we do offer some workshops on a fairly regular basis here at Metastar, and those are all free of charge. Many of the full workshops actually offer continuing ed credits and certificates. So those are available as well. And like Ashley said at the beginning, we are just working on sort of developing what does our full portfolio look like of motivational interviewing? What would it be useful for us to develop to offer to you? So please, if you have feedback on that, don't hesitate to let us know. You should have both of our emails, but if not, you've got Jen's, who's the person who sort of coordinated the webinar, and you can always send a question to her and she'll get it in the right place as well. So some good spots to find some value network of trainers website, and Guilford Press is the publisher that publishes quite a few of the motivational interviewing books and workbooks. If you want to look for some other online resources, some things you can type into your favorite search engine. This is an online course. The British Medical Journal has one called Learning Motivational Interviewing. The American Academy of Pediatrics has a program called Change Talk. The National Institute on Drug Abuse has one that looks at chronic health conditions, not just drug abuse. It's just that's who's funding it. And the Addiction Technology Transfer Center Network has a tour of motivational interviewing. That's also an online course. So there are some online courses available as well. We just have a minute or two left, but John, if you want to remind folks, if anybody has any questions, we can open the lines for Q&A, or you can pop them into the chat box as well if you have any last questions.
Thank you. Once again, if you do have a question, star then 1 on your touch-tone phone. And I have no questions in the queue at this time.
Thank you. So there's a question about a copy of the PowerPoint. That could be made available. So feel free to email me and I can just send you that if it doesn't already come. It may already come in a follow-up email, but I don't believe it will. And if it doesn't and you want it, please feel free to email me and I will send it your way. Okay, we are at the hour, so in absence of any other questions, we'll go ahead and just wrap this up. I just want to thank you all for joining us. It's been lovely to share with you over the course of these 2 webinars a little bit about motivational interviewing. I hope we've whet your appetite and you're now interested, and we'll be looking out for future opportunities to learn more. And we will be looking out for questions from you or feedback from you about how we can best meet your needs in the future. So thanks everybody for joining on.
Thank you, ladies and gentlemen. That concludes today's call. Thank you for participating.